I'm going to check the environment. Hello, my name is Wenjing Shi. I'm going to start my assessment. Hello, my name is Wenjing. I'm your prime nurse today. Can you tell me what's your name, please?
My name is Feng.
Okay. Can I have your date of birth?
January 1st.
Okay. Do you know where are you?
In the hospital.
Okay. The patient vitals checked. The blood pressure is 115/70. Is within normal limits. The patient temperature is 39.7 is abnormal. Patient heart rate is 115 is abnormal, and the respiratory rate is 22 is abnormal. Can I have some questions? Do you have any headache?
Yes, my neck is really stiff.
Where is your pain?
All over my head.
Can you describe the pain?
Throbbing.
Okay. Does it spread?
It does not spread. I just feel very fatigued, tired, and dizzy.
Can you rate your pain from 0 to 10? 0 means no pain at all. 10 means the most pain you have had.
The worst 8.
When does it start?
A day ago.
It's on and go or is consistent?
It's all the time.
Okay, what makes this worse?
Movement and light.
What makes this better?
Falling asleep.
Okay, do you take any medication for that?
I tried to take Tylenol and Advil, but it didn't work.
Do you know the causing of the pain?
I don't know, just feel sick.
Did you have any head injury?
No.
Do you have any dizziness and vertigo?
Yes, I feel dizzy and just making me nauseous.
Do you feel any seizures?
No.
Do you have any tremors?
No.
Numbness and tingling?
No.
Okay, do you have any difficulty in swallowing and speaking?
No.
Okay, do you feel short of breath?
No.
Any coughing?
Yes, I have a cough, but it's not too bad.
Do you have any spute?
No.
Okay, do you feel any pain when breathing?
No, but chest hurts a little.
Do you have any medical history?
I had a type 1 diabetes and tonsillectomy.
Okay, for the pain management, I'm going to provide the quiet and the dim environment and limits patient's movement for the comfort. Also, I'm still going to connect to the doctor to ask for more medication for control the pain because the Tylenol and the Advil doesn't work for the patient. The patient looks very ill and weakness and unsteady gait noticed and has slightly elevated respiratory rate, but no obvious distress noticed. And the patient has very difficult with neck movement. Patient lip is pink, is normal, and the patient is alert oriented to the person, time, and place. The patient has slightly elevated the respiratory rate and effectiveness, quiet, non-labored, and no accessory muscle used. And the patient's eye opens spontaneously and responds to the person, time, and place, and followed common GCS is 15. So I'm going to use the pen light to check your pupil. Don't move your head, just look at. Don't move your head. Okay, look at my pen. I'm going to put my pen close to your eyes and move around. The patient pupils are 3 millimeters size and equal around reactive light and accommodation. Can you hold my hand and squeeze my hands? Okay, can you push my hand? Okay, push my hand back. Okay. The patient, the strength of the hand and the legs are equal bilaterally. Strong 4+. I'm going to hear your lung sound. One, 2, 3, 4, 5, 6, 7, 8, 9. Okay, the crackle sound noticed throughout the lungs. And the normal sound should be no wheezing, no crackle, and clear air entry. The patient, Ms. Feng, 17 years old female came to the emergency with a complaint of the headache, neck stiffness, nausea, and dizziness. And the patient is uncontrolled type 1 diabetes patient and has surgery of tonsillectomy. And the patient denies the head injury and any numbness and tingling. So the vitals shows febrile with temperature 39.7 and tachycardia with heart rate 115. The respiratory is slightly elevated, is 22, and the blood pressure is stable. The patient looks very ill and very weakness. The patient GCS is 15, and the further assessment for determining the headache and neck stiffness is needed, such as the CT head, lumbar puncture, blood work, including CBC and blood culture, and X-ray. I'm going to provide the ice packs, and I'm going to encourage the patient to increase the fluid intake for control the fever and for the comfort. For the critical thinking, the patient possible has meningitis, and 2 nurse intervention. The first one is I'm going to check and close monitor the blood sugar because the patient is uncontrolled diabetes, type 1 diabetes patient, and the illness and the infection are going to be triggered the stress response, which can increase the blood glucose. The second one is I'm going to close monitor the respiratory status and provide oxygen as needed, because the patient complains of the coughing and the crackle sound heard from the lungs and slightly elevated respiratory rate. And for the expected orders from the physicians are imaging and lumbar puncture. For the imaging, the patient should have the possible have the CT and X-ray because patient has coughing and has slightly elevated the respiratory rate and crackle sound noticed. It's going to be helped to rule out the respiratory infection. For the lumbar puncture, we're going to collect the sample from the cerebral spinal fluid to determine the meningitis. Thank you.